Welcome back to my channel. Today, we're discussing the new COVID-19 variant, XEC, which is spreading rapidly across the United States. This variant, which was first identified in Germany in June, has become the second most prevalent strain in the country, according to data released by the CDC. As XEC gains ground, representing more than 1 in 10 cases in the U.S., many are wondering how it differs from previous variants and what symptoms to watch out for. According to experts, XEC doesn't seem to cause different symptoms than other SARS-CoV-2 variants that have circulated in the past. Professor Francois Balloux, a computational systems biologist at University College London, noted that XEC is expected to produce the same symptoms we've seen with previous variants. These symptoms include typical cold and flu-like signs such as a high temperature, body aches, fatigue, and a cough or sore throat. Despite its spread, XEC does not appear to be causing more severe illness than earlier strains. One key factor with XEC is its growth advantage over previous variants, including the flurried variants that drove the COVID case surge earlier this year. Dr. Elizabeth Hudson, an infectious disease specialist at Kaiser Permanente Southern California, mentioned that XEC is definitely a variant to keep an eye on due to this growth advantage. However, Professor Balloux shared some optimism, suggesting that this surge may not be as severe as previous winter outbreaks because no completely new proper variant has emerged this year. The variant is a recombinant form, meaning it is a rearrangement of two pre-existing variants, KS.1.1 and KP.3.3. These variants are part of the Omicron family, and XEC's mutations in its spike protein, the part of the virus that allows it to enter human cells, may help it spread more easily. The spike protein also serves as the primary target for our immune system and vaccines, and XEC's changes may allow it to better evade immune detection, which is why it is spreading rapidly. So far, over 3,900 cases of XEC have been sequenced, with most of them detected in Central Europe, where it accounts for more than 30% of all COVID infections. While less common in other parts of the world, XEC seems to be increasing in frequency globally, which is why health experts are closely monitoring its spread in regions like the US. Despite this, there is cautious optimism that the current tools we have, vaccines and prior immunity from infections, will still provide good protection. It remains unclear how well the existing vaccines will protect against XEC specifically, but Professor Balloux said that they are likely to provide at least some level of protection. This is reassuring because, even though XEC has a slight transmission advantage over other variants, the protection from vaccines and past infections should still be effective in preventing severe cases of COVID-19. Dr. Hudson emphasized that we shouldn't expect COVID to follow a seasonal pattern like the flu, with cases being detected at high numbers year-round. This highlights the importance of staying up to date with vaccines and booster shots, as they continue to provide strong defense against severe illness, even with new variants emerging. Thanks for tuning in. Remember to subscribe to stay informed about the latest updates on COVID-19 and other health topics. Stay safe, and see you next time.